frame this conversation. Let's talk about the aspects of the Affordable Care Act that pertain to small business. What are those aspects specifically targeted towards small businesses in the new healthcare law?
The most specific programs in the Affordable Care Act are, first of all, creating exchanges that are specifically designed for small business, the so-called shop exchanges. And those are places where small businesses will be able to post for their employees a range of insurance products
Give them some options
that they can choose from. And for small businesses, this is a big deal because the big problem small businesses face is they're small and they don't have a lot of people to pool their risks with, and consequently they pay higher prices. They pay as much as 20–30% higher than businesses that have more employees. So that's one big program directed specifically at small business. Another is to subsidize the cost of insurance for certain small businesses. Now that program's directed at the smaller of the small businesses, those with fewer than 50 employees and with relatively low payrolls, an average payroll of 50,000 or less. And again, the idea is those are the businesses least likely to be offering insurance today and most in need of help. So those are the two major programs that are specifically directed at small business. But there are a variety of other programs in the Affordable Care Act. So some people have called it a hodgepodge because it tries to do a lot.
So, okay, so let's talk about that for a second. So there are components that are not directed specifically at small businesses. Are you saying there are other things that will indirectly help small business?
Yeah, just by way of background, I think when Congress looked at health care insurance, it found two groups that really were getting the short end of the stick. First and foremost, of course, were individuals who had to buy on their own. And that's why it set up exchanges in the first place, for them to have a range of insurance products to choose from. But the other was small businesses, and they pay higher rates for a variety of reasons. They have to pay brokers, they have few insured, so hence they have bigger risks and insurers charge them more, and they have other higher administrative costs. So Congress was very attuned to their needs, and it tried to focus on them specifically. But the larger picture for the ACA is it tries to do a lot of things, and some have called it throwing spaghetti against the wall, but there are a lot of cost containment ideas that are being tested in pilots, other kinds of new ways of doing healthcare, fundamentally aimed at changing the delivery system. Now, nobody knows how many of them will work or when they'll work, but it's fair to say they're trying a lot of things. To the extent those things work and do lower costs, that's going to help small business a lot. And a second way small business can be helped is by indirect means. A lot of people today suffer from what they call job lock. They're in a job and they're staying in that job for one reason, and that's to keep health insurance. They might be better qualified for another job. They might want to move out to another job, but they're stuck because of health insurance. To the extent the Affordable Care Act says to those people, you know what, we're going to make affordable health care available to you as an individual on an exchange, they'll have an opportunity to do that. That could help small business in various ways. It would help those small businesses that decide not to offer insurance. In other words, they can now hire employees who might not otherwise move because they can find affordable care on their own in the individual market. So there are these indirect benefits that can accrue through the Affordable Care Act that potentially could be very helpful.
Of course, not every